Virologist from USF Health, Dr. Michael Teng, addressed the vaccine timeline and what it could mean for a potential end of this pandemic.
What do you think is a reasonable timeline for kids to be eligible to be vaccinated?
I think it should happen by May at the latest. Both Pfizer and Moderna have also enrolled kids down to 6 months of age this month. So a couple of weeks ago was Moderna, and last week was Pfizer.
Right.
So that data should come in by summertime.
Dr. Teng says the vaccines could be approved for kids by the start of or early into next school year.
We had a viewer ask specifically, if I've had COVID-19, do I still need to get the vaccine?
Yeah, absolutely. The first thing is that when you get natural infection, there's a greater variety in the amount of host response you get, the immune response you get. So some people are protected, some people are not as well protected. When you get the vaccine, especially after you've gotten recovered from COVID, you get a really strong immune response. You know, the Pfizer and Moderna vaccines, the J&J vaccines, they seem to give you this kind of higher level of protection against reinfection. And we know that reinfection can occur after natural infection.
According to the CDC, you'll have immunity for at least 90 days after. So if you've just recovered from the virus, wait a few weeks before you're vaccinated.
We're well over a year now into this pandemic. People are looking for a light at the end of the tunnel. Is there a way to timestamp the end of this pandemic?
You know, I would expect to see getting close to herd immunity, decreased transmission by the fall. This is a global pandemic. And it's not going to go away until everybody gets vaccinated, right? Until we have herd immunity globally. So we'll still have to think about this. There are some countries that haven't even administered one dose of vaccine.
Well, send us your questions for Dr. Teng. We'll bring you the answers each week here on Brightside. You can submit them by texting us 727-577-8522.